Hello everybody. Today we are talking about the national health insurance. Nowadays, more and more people want to live under capitalism. Also, more and more people believe in democracy. When you have been to many countries, you can compare A countries with B countries. Then you will find out something good to live under democracy. What is difference between each system? Even though they are under democracy, doesn't mean that they got the same good policy. Here comes the point. What's Taiwan's representative? What's Taiwan's representative policy under democracy? I think that is health insurance. So today we are going to talk about health insurance, how the health insurance work in the modern society.
Hello everybody, my name is Annie. According to how much the government intervenes, we can divide the national health insurance into three different types. The national health service model, the social insurance model, and the private insurance model. Today, I'm going to talk about the difference among these different types of national health insurance. First of all, NHS. National Health Service is a kind of national health insurance whose finance comes from tax. The ownership censorships of medical service institution belongs to the government. This kind of national health insurance is popular in most of the countries in Europe such as England, Denmark, Finland, Iceland, Sweden, Greece, Italy, and blah, 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 blah. Second, we're going to talk about NHI, the social insurance model. This is what our country is using nowadays. This kind of health service is mandatory. Everyone should share the cost of medical treatment. Medical expenses are paid by the disease insurance fund, and the source of the disease insurance is funded by the government, employer, and people. These features of this kind of health service is financial independence. People won't be confused with the government expenses because the social insurance system can take the financial sustainability into consideration. It has the advantage of medical efficiency and social equality. The public health insurance system based on this system is adopted in many countries such as Germany, France, Canada, Switzerland, Austria, South Korea, and Japan. Let's talk about the private insurance model. The final one model is employed by private hospital, clinic, or health insurance company. Here comes the point. It is hard to seek doctor when you are sick, and it is much more expensive than other model. America is a typical one. Taiwan's health insurance is similar to Germany model, which belongs to the social insurance model, and we also get some benefits and problems.
Hello everyone, I'm Andy and I'm gonna talk about the advantage and the shortcoming about national health insurance. First, we got like three lines of advantage. The first one is direct advantage of the NHI. Let me explain it, because if the citizen of ROC gets sick, national health insurance can help solve families or individual economic issue, especially while patient has some serious illness, for instance, cancer. It can take care of most of the expense except some others. And the second one, Health Insurance Bureau announced that citizens who has been diagnosed with cancer or congenital disease can own a catastrophic illness card. In the next 5 years, people who has that card could just pay for a few bills. And the third one, National Health Insurance offers citizens with free health checkup. The inspection items include physical examination, health counseling, blood tests, and urine routine. And the next is about the shortcoming of an NHI. Look at the slideshow. We can see that there is a man out of money, and that stands for our government do not have enough budget for national health insurance, while our economy still doesn't get better. And the second one, besides the man, it's a house gonna falling down, and that stands for the instruction of national health insurance is not well and complete enough. Businessmen who have to afford much more than people who work for government, and this kind of mechanism is not fair to everyone.
As you can see, Taiwan's healthcare insurance is like Germany. Not all, but almost. But we still have some problem. First of all, the prisoners really need health insurance. I know. This is really a tough question. Because, some people say yes, some people say no. Whatever it is, in our team's opinion, we think yes. Why not? Why? Because we think human rights is really an important one in democracy. And as you can see, Taiwan is the most democratic country I have ever seen. So I think whether you are a prisoner who committed a crime or you are a normal person, we still have the same right. And the second question is a second generation national health insurance really need? I know you don't know second generation national health insurance what. Second generation national health insurance is like the Taiwan's health insurance, but it's like more improvement from first generation. Because nowadays people have to pay more tax about the health insurance, so the government think people should not pay more, so they change the rules to second generation national health insurance. But I think this is not necessary because the second generation national health system is not all used to every country. For example, in my country, I have second generation NHI, but our health resources are not the same as a country like Taipei or Kaohsiung. So I really think that second generation NHI is not necessary for now. Okay.
Above all, health insurance can stabilize the society and prevent the people from illness. Think about this. People want to live in democracy because they want to participate in the policy and get more benefits from the government. Health insurance is one of the biggest policy that affects our daily life. And there are a high percentage of citizens can keep using this system. So I can say that health insurance is a theme of democracy. Thanks for listening.